Yeah. What?
You can just kind of say your background. And
my name's Eric. I am an ER doctor here in town. I've been out of residency for a couple of years now. I did that training in Tucson, Arizona. I'm originally from Cincinnati, Ohio. And my wife and I moved out here a couple of years ago, and we love it. So we've got some family in Castle Rock, which kind of circled us back into being here in town. So, yeah.
Cool. Laurie?
I'm Laurie. I have been a PA for many years. Been working ER for many more years. Moved out here from Oklahoma in 2020. My family are out here and having a great time.
Cool.
Daniel Grothe, 42, from Tulsa, Oklahoma as well, and been here 20 years. I'm a pastor at New Life Church in Colorado Springs.
Oh, you've been here 20 years exactly? That's how long we've been here now, too, from Nebraska.
Okay.
Very cool. So the topic I wanted to get into today, we've kind of discussed a little bit in previous podcasts, just because it's a topic that's of interest to me, and I'm curious people's perspectives on it. In our line of work and in Daniel's line of work, we deal with death and dying a lot. And a question I commonly ask is like, where is God in EMS is kind of how I phrase it. Because I think that's the question I've asked myself many times. And not that I've ever doubted my beliefs. I've considered myself a Christian my whole life. But I've definitely wrestled with God over a lot of the things that we see, quite a few times. So that's kind of what we're going to get into today. And I want to start by kind of asking Daniel what your life as a pastor looks like encountering these things and in and out of the hospital, and maybe seeing families in their homes with patients under hospice, and just kind of see what that looks like for you, so we can kind of compare it to our own work.
Well, I actually think about you all a lot because especially when you've been out in an ambulance or running around town, you all are first responders. You're the front line. And I think of myself as sort of an emotional and spiritual first responder. So I get calls. I remember getting a call early on as a young mid-20s pastor, and a teenage boy had committed suicide. And the parents called me. So I run over there, and I'm standing in the backyard with a 16-year-old boy's body and wailing, aching parents. And they don't prepare you for what you'll see. I mean, there's just nothing that can prepare you for what you'll see. I remember my first training going down to the morgue into the sit through an autopsy. And they said, if you're going to be a pastor, you're going to have to be able to tell families what's going on when their loved one dies. Mm-hmm. So you're going to need to see the whole thing. And so I'm in there for an autopsy with the coroner, and then they bring in another body, and you go into the freezer, and there's bodies stacked up in there, and it gets real really quickly. I've held dead babies that were just born, and mom and dad, one of my first calls, pastor on call on a weekend, was a 7-month-old baby boy. It was Saturday morning. Mom and dad got up. Their son was crying at 6 a.m. And mom went in, did everything right, patted him on the back, gave him his pacifier, rubbed his back, and he went back to sleep. 6:15, she opens the door, peeks in to look at him. He's quiet. And she walks over, and he's dead. SIDS. And that was the first funeral I oversaw as a 24-year-old pastor. So I pray for people like you all the time, because you're in it. You're the adrenaline, the stuff it's just a lot. And on the spiritual and emotional and relational and sometimes physical side, I'm kind of there. So
yeah, that's kind of what I suspected. I mean, I've never asked you about like what that looks like, but that's kind of what I suspected. And it's very similar to our EMTs and paramedics. Like, you're a 21-year-old paramedic, you kind of know what you're doing. That's how I was. And all of a sudden you're asked to go in and you deal with, these, irreversible cardiac arrest, maybe you work them for a little bit and you don't get them back, or it's too late to do anything, and now you're asked to talk to the family and help them deal with this emotionally and explain, and you're like, I was not trained for this. I was trained for like working the cardiac arrest and pushing the drugs and intubating people, but I was not trained how to talk to a family. And so that's very interesting that as a pastor too, you're like, you kind of just have to do it.
My dad's a pastor. My mom's a pastor. So I've been in it my whole life. And this is my lunch today. I have my lunch open up and I walk down to my dad's office and I go, hey, you want to go get a smoothie? So we jump in his car. We're driving. And I said, what's your week been like? And he said, well, there was a 21-year-old girl who just died in a motorcycle accident this week. Wasn't her fault. She's gone. And she's the oldest of 5 kids. And he said, I went into the family's house, and on the kitchen table, they had her helmet in 3 pieces. It was broken. And they held up a plastic bag.
Oh, my gosh.
And they said, well, what's that? And it was the fragments of her skull that were in the helmet. And what? I thought I was going to be opening the Bible and quoting Psalm 23 and having precious little moments dedicating babies. No, you have signed up to, you've taken an oath. You've taken oaths, vows. We've taken oaths. Yours is the Hippocratic. Ours is, the spiritual version of that. Like, you step into life where people are, you meet them where they are, and you try to bring healing to them where they are. And it costs what it costs, and a lot of times it's very costly.
Mm-hmm.
Is it a much bigger proportion of your job than you ever thought it was? Because I guess, I feel like I never think about pastors dealing with this frequently. You don't, I don't hear it.
Morgue training, a part of your curriculum?
It was for us. Yeah. It is a much, the ratios are skewed in a way that you wouldn't have expected. I would have thought, I'm going to be preaching, I'm going to be doing weddings, all of that. But it's life and death. Its stakes are high. And I got a 2 a.m. phone call 2 weeks ago. It just startled me, like a 2 a.m. phone call does. And it's a guy who was a member of our congregation who someone gave him mushrooms. And he was tripping out, losing his mind. Pastor, you got... And, just, it rattles you. I spent the next 2 days trying to recover from the adrenaline rush of that. So, yes, I tell young people aspiring to ministry, like, just know what you're signing up for. We need you if you're called to this, but do not assume that ministry is stages. Standing in front of people, articulating the beautiful gospel of ministry is walking through the valley of the shadow of death with people. And sometimes there are those climactic moments where there's celebration and joy and blessing. And a larger portion of the time it's the pain. Yeah.
I think that's something a lot of people probably wouldn't guess. And maybe me years ago, I wouldn't have guessed it either. I look at being a pastor and I see you on stage. I'm like, oh, Daniel prepares a sermon all week. He's at home meditating and exercising and preparing this. But that's not the reality of being a pastor. But that's the side that you kind of isolate from everyone else, because that's kind of your burden to bear as a pastor. And people don't see that. The
most visible part of my job is the portion that I spend the least amount of time on.
Interesting.
So I'll spend 5 hours of my week to 8 hours of my week getting ready for that sermon. Early on, it was 20 hours a week, but I've gotten better at it. All of you know what proficiency is. That the stuff that used to take you a long time, you're getting quicker. Mm-hmm. So I'm quicker with my preparation, and the majority of what I do is out pounding the pavement with people, going into homes, going into hospitals, going into rooms I never thought I would go into.
And there's another aspect too of being in someone's home, like being a paramedic and EMT before. There's something like so intimate about being like in someone's home when someone has recently passed. It's different than, we're a little bit sheltered in the ER. We have a chaplain that can come and deal with the emotional side, and we can just deal with the medical side and move on to that next patient, because out of necessity we have to work that cardiac arrest, and then by the time we're done with that, we're behind on 5 other patients immediately because we've been in there for so long.
Right. And then
Whereas
the family with that gets shuttled away.
Yeah, they isolate us from the family. They put them in a room so we can go talk to them when we have time. It makes it a lot easier in aspects, I think, in the ER, where I feel like I don't have as much traumatic experience as I did as a paramedic, just being in the home where you're forced into these scenarios, and like you're seeing their pictures on the wall, you see their photo albums, you know. Some of these are deaths that maybe they were expecting, but a lot of them are sudden and completely unexpected, and there's something very just intimate about being in someone's home.
I always feel like
dealing with that.
If someone makes it to the hospital, there's probably an increased chance that they make it alive as well. And I feel like you kind of walk into a lot of lose scenarios in people's homes, you know.
Yeah, people have been dead for hours,
yeah.
and you're like, we can't attempt anything here, and yeah, so it's in the ER, we at least have a chance usually if they make it in, but yeah, the EMTs and paramedics just see so much more death, I think, just by nature of the job and the location. You know?
I mean, back in Oklahoma, I worked at a facility that was really like 20 miles either way between capable facilities, surrounded by a huge rural community. And so we actually ended up at that facility a lot. We would get like traumatic farming, traumatic highway accident people, and it had kind of a flavor of an on scene. You know, the family would rock and roll up with this, you know, deeply injured person who's like actively dying. We can't stabilize him enough to get out. And then they would just sit there in the facility for like hours as we're trying to coordinate next steps and getting like the coroner and this stuff. And so, you know, it had the vibe of that busy ER, we need to keep going. And then, you know, trauma bay 2 was just a revolving room of like death. Yeah. You know, and that was the kind of facility too where everything was drapes. And so you could just hear like the weeping and wailing, and like there's no training for that.
Yeah, that weeping and wailing, that scream of a parent, or that's hard to recover from when you hear that. And like I feel like in my work day, when you hear that, like you're kind of trying to focus on everything else, and that's part of why I do this podcast, though, is to have these conversations. We don't have time to have at work. Like I couldn't have told you a lot of which providers are believers or not, because we don't talk about it at work a lot of times. We don't have time to talk about it at work. And that's why I wanted to bring in specific, you know, believers to kind of have this conversation. But the biggest call I can remember from my career as a paramedic that kind of like made me wrestle with God, so to speak, was the death of a 4-year-old that we ran. It was one of those 2 a.m. calls. You know, we were on call for a 48-hour period. We wake up and we immediately see on the pager that it's a cardiac arrest. A lot of calls, like they're constantly getting the information, you're getting updated as you go, but when it's a cardiac arrest, it immediately comes out as a cardiac arrest, you know, because the caller says, no, they're not breathing, no, they don't have a pulse, so you know what you're getting right away, and then we see it's a 4-year-old, and we're like, oh no. And this was a particular station out east where our transport times are very long. There's no resources near a lot of these homes, and our ETA is like a half hour, and we're like, oh man, a half hour, that's really bad. So, you know, we drive super fast to get there, and there's a BLS fire department on scene doing chest compressions, and you know, the parents are kind of shell shocked. I don't know what the scenario was, how they discovered this at 2 a.m. So I do all the paramedic things, you know, we give epinephrine and all the drugs and intubate them, and, you know, do all these things to no avail. And we ended up flying the kid to the hospital anyway, just because I didn't have it in me to pronounce him there. And then we drive back to our station and try to go back to bed after that. And it's like, I can't go back to bed after that. But that was one where I was like, I took over chest compressions at one point just so I could physically put my hands on this kid and be like, God, if you're going to do something, you know, now's the time. And, you know, to no avail. And, you know, that was one scenario that kind of made me like question, like, where's God in this scenario? You know, like, I believe that God can heal. I believe that, he uses our hands to do things. And I still believe that God uses our hands in a lot of scenarios,
Sure.
Maybe it's through the defibrillator pad. Sometimes he's using us to help people, but he still uses us. And that was one scenario that made me wrestle with God for a little bit. And I'm just curious, from all your guys' experience, including yours, Daniel, has there been specific scenarios that have made you maybe question God, wrestle with God, be angry at God more than others?
Yes, 1,000 times. Maybe the easiest one to pull up right away is being in church on a Sunday morning and standing at the end of our children's hallway. We've got thousands of people there, and I hear ba 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 ba, and a man with an AR-15 ran into our building with 1,000 rounds of ammunition, and he's spraying bullets everywhere. And I run into our senior pastor's office, my boss, my dear friend, and I dive under the desk. There's a shooter on campus, guys. Get down. My sister is 8 months pregnant. He ran right by her. She called me. She's like, "Where are you?" And I said, "I'm under Brady's desk." And she said, "Stay there. I just saw a guy kill 2 girls.
Oh my God.
He killed 16 and 18-year-old sisters in our church parking lot on a Sunday morning. Runs in our building. And we still have bullet holes in our wall at the church in the drywall. We've painted over, but I could take you and show you spots." And my sister said, I looked the devil in the face. Like,
Yeah.
he's coming down the hall. And a 5'3" lady security guard runs after him and shoots him in the leg. And then he blows his brains out at our children's check-in counter. So I'm 24 at the time. Young pastor, just buried that little 7-month-old boy. And now we've got 3 dead bodies. We put on, I didn't know this, but you have to clean up your own crime scene. So, and that makes perfect sense. Police officers can't do that. They got to go to the next call. So we've got a dead body there. They take the body, but his brains are on the wall. And so we put on rubber gloves and wiped his brains off the wall and cleaned the blood. And there's glass everywhere. So you want to talk about going, Lord, where are you? What happened? It's real. And so I'll just kind of geek out a little bit, as, you're using acronyms I don't understand, and you guys are speaking a beautiful language. I hear Christians say in the church, like, I want to see miracles. I want to see the book of Acts. I want to see the miracles happen. The blind see, the lame walk, the deaf hear, the dead raise, all the miracles. Well, what people don't realize is that the book of Acts is written in a time span of 40 years. And it's 5 major cities. So I tell people who say, hey, I want to see, God, why aren't you healing people all the time? Why are we not batting 1,000 with miracles? And I said, if you want to see the book of Acts, commit to a place for 40 years. And over the course of 40 years, you will see all of those things happen. But you will also bury people, and you will weep, and you will mourn, and you will grieve, and you'll have to walk with families who are figuring out what it looks like to be down a child. So it's both and. The Spirit does break in. Miracles do happen, but not always, and it usually takes 40 years to see all of the stuff in the book of Acts happen in your life.
Yeah.
That's a good point.
It sounds like, both the examples, it's the question of, like, why do bad things happen to good people? Why do bad things happen in general? It's the age-old question. I think it's just, in all these examples, it's a lot more real than other examples, I think.
Mm-hmm. Mm-hmm. And what we're doing, I think, and so for me, I'm sitting with 3 people that I would consider to be kind of hero status. Like, what you're doing is magic to me. And what you're doing is doing the work on this side of eternity to participate with God. So we know one day, if you read Revelation 21, the eastern sky is going to split and Jesus Christ will return and the dead in Christ will rise and there will be no more sorrow, no more mourning, no more suffering, no more pain, no more death, no more tears. For the old order of things will have passed away. So we are all saying, come Lord Jesus, do that thing. Where we don't have to do any more funerals for people. Like, there's a day coming, but on this side of eternity, what we're doing is we're stepping into the place to bring healing, to bring comfort, to on God's behalf, be his representative to people who are suffering. So we know that day's coming, but on this side, God needs some people who will sign up to step into the worst scenarios. And Jesus, he goes in and bears in his body the full sting, the weight, the death, the ache. And your job is participating in that ache until the day when there will be no more ache. And so as a pastor and as medical professionals, I think we've been called to be God's representatives in some of the worst rooms you could ever walk into.
Yeah, that's a good point. I think all of us that get into the healthcare field, physician, PA, nurse, EMT, paramedic, get into it because we want to help people. We want to heal people. And I think it's very easy in our workflow to kind of forget the reason we got into medicine to begin with. We're dealing with, the person that's super high on meth and they want to kick everyone's butt in the ER and we've got to sedate them heavily and protect everybody from them. And,
right. and
then we're immediately going to a cardiac arrest
right.
and we need to talk to family about how they're not salvageable. And we're going to cease efforts to the ankle sprain that just checked in. That
right. And their mom who wants that blanket for that ankle sprain.
Yeah.
Right.
Yeah, like a nurse
right
told
now.
a story about walking out of this cardiac arrest. They'd been working for like 2 hours. And a patient comes up and was super rude, or a patient's family member walks up and is super rude, like, hey, we've been waiting for a blanket for an hour. And it's like, well, we understand you don't realize what's going on around you in the ER. Like, we get that, but we're working on somebody whose loved one just died and you're here for an ankle sprain. And so I think it's easy to get lost and completely forget why we get in this field. I mean, I've forgotten why I've gotten in this field a ton of times, in the workflow of our shift and just getting task oriented and I need to do this and then that and that. And kind of turning off that emotional side of yourself, which I think we have to do out of necessity a lot of times because we have to move on so quickly from that traumatic patient to the next patient. And that's one thing you said too, and that you talk about in your book, The Power of Place. That is what it's called. Is staying in a place for a long period of time, long enough to see these things happen, I think is so key. And especially in our world now, people are so transient in their jobs. They go from one job to the next. And I'm asking myself, how can I stay in this career for another 25 years without burning out, without coming home angry every night? And so that's something we talk about a lot on this podcast, which you're all in great positions to speak to, is how do we avoid burnout from all this trauma that we see? Like, how do we not bring this home to our families? How do we not take on every single burden that comes our way in the ER, but still take on enough of them that we can be understanding to the family and reassure them and actually connect with patients, which is why we all got in this field, is to connect with patients. But how do we do that and strike that balance of not also taking on all their burdens as our own?
I mean...
Yeah, I working at one of our intermediate facilities in town, it reminds me of the other day we were complaining about all this stuff that was coming in, the nursing team, staff, and overnight, and we were, like, oh, another person with a sore throat and the cold. You don't need to be in the ER for, I'm sick. And then next thing you know, this lady comes in who might be having a stroke, and we're like, she shouldn't be here. She should be at a bigger hospital. And I was like, wait, hang on.
You can't have both ways.
Yeah, we're like, and I think I kind of called it out to all of us, like, guys, we need to step back and think we just need to, do a good job and, I think treat these patients and these people well, no matter where they're at, because they don't know. They're all coming looking for help. And I think when I step back and remind myself of that, that's what kind of keeps me rooted a little bit. I always dog on, like, I think one of the monks, the St. Francis quote, like, always preach the gospel, and when necessary, use words. And I'm always like, you have to use words.
You have to use words.
You know, but I think we don't always have the opportunity to use words. So it actually, I think, is pretty applicable for us in the healthcare field, because sometimes you just can't sit down and break down, you know, I know your toe really hurts, but have you heard of our Lord and Savior Jesus?
Right.
You know, so, but I think in the way, you know, you can approach this, because I think there's some docs that I'm sure, you know, and providers we work with that are like very dismissive and rude to certain, you know, to some of these complaints from people. But if you can approach someone from a place of love and kindness, no matter where they're coming from, and meet them where they're at, you know, and I think if you do that, you earn the right to be heard if an opportunity does present itself to somebody.
I mean, I think it's like a very human response, and something that I think in the hospital setting we have to fight a lot, that burnout, camaraderie that comes in with dealing with really dumb patients back to back to back. And, you know, it's that natural human desire to be like, oh, that person is just ignorant. That person is abusing the system. This person is, you just start like classifying, boxing, and then it just makes you angry. And, you know, this is kind of relevant for me currently, like to actually step back and see that I'd like really internalize that. And if I'm really going to follow through on my beliefs here, that smelly homeless person that just puked on my shoes is, you know, made in the image of God. We are the same created being. We have the same created worth. So, like trying to excuse their behavior in like a cultural way, like I have to make a conscious decision not to do that, because for me, I've really had to be honest with myself, and that desire to just rail on the patient that shouldn't be here and rail on the patient that shouldn't be here. Or
did you call it burnout camaraderie?
That's
like a profound phrase,
and it feeds on if it feeds on yourself, and you know, like it feels good in the moment, but like I have to stop and step back and be a leader for it.
Yes.
Even when it sucks.
That's a really good point.
Set the tone.
No one's ever made before is it starts this cycle of everyone's getting riled up, and it only leads to burnout. This isn't helping you at the end of your shift. Jeez. This isn't helping you go home and forget about your day to love on your family. This is contributing to everyone's burnout.
And it was that. It was kind of like a rotting away of a part of like my, you know, the way that I'm interacting with myself, the way I'm interacting with my family. And I mean, you know, we talk about it as this like dark humor, and sometimes it's really funny. But a lot of the times it's just like dehumanizing. It's removing responsibility. It's like, and not only are you leader in like the staff and the environment to create something healthy, just kind of like what that, you see that said St. Francis, like you're exhibiting the gospel to people who might not be able to see it. You know, you're leading to your patients maybe to gently be like, well, thankfully your stubbed toe is not going to kill you today. I do need you to be patient while I go deal with another person. Thank you for being patient here. Let's just practice a little bit more grace for everyone.
I was talking with some of the staff at my shift last night actually about, you know, like your cloud stat, like you talk about you're a white cloud, you're a black cloud with how things are. And I've kind of been saying lately, it's like a state of mind, I think, and an attitude. Because you can be getting crushed and destroyed on shift with all these bad things happening, but if you're maintaining a good attitude, that doesn't feel like a black cloud. If you are bringing some peace and calmness to the environment, you know, it's like I am a white cloud no matter what walks in the door, you know. So and I would like to think that flows down, especially from like the provider role to everyone else around it. And you know, now that, you know, being out of the residency situation and in like a more leadership role, I definitely see that.